Welcome everyone to today's webinar titled Your Workplace Health and Safety Questions Answered. We have a very informative session planned for you all, so let's get started by introducing our expert panel. Jonathan Isaacson will be facilitating our panel discussion today. Jonathan is the chairman and CEO of Gemline. In an ongoing mission to be the industry's most trusted supplier for PPE, Gemline has assembled a panel of experts in the fields of epidemiology, environmental health, and environmental engineering to provide counsel to Gemline and its customers as we collectively navigate through the new normal in light of the COVID-19 pandemic. The Gemline Standards of Care Advisory Committee panel members are Dr. Joseph Eisenberg. Dr. Eisenberg is a professor of epidemiology and chair of the Department of Epidemiology at the University of Michigan School of Public Health. Dr. Nancy G. Love. Dr. Love is an engineer and professor of civil and environmental engineering at the University of Michigan School of Engineering. And then finally, we have Dr. Rick Netzel. Dr. Netzel is a professor of environmental health sciences and associate chair of the Department of Environmental Health Sciences at the University of Michigan School of Public Health. Additionally, he is a certified industrial hygienist and exposure scientist. We are very pleased that they are joining us today for the discussion. And now I'm going to turn it over to Jonathan.
Welcome, everybody. There were three reasons that we put this committee together. The first one is that as our industry has pivoted towards providing PPE to organizations across the country, and as Gemline moved into that business, we wanted to make sure that we were providing the best possible product that we could. And so our committee has been tasked with helping us with product design and information. In addition, the committee has helped us with facility safety, making sure that we have a safe work environment for the associates who are coming in. And the third reason is what we're doing today, which is to provide information to the industry. And this is part of an ongoing effort that Gemline has had to provide the latest information about the pandemic. Today, we're not going to be talking about selling PPE, but rather best practice around PPE and safety, both in the home and the office. And then in the end, I hope to take some guesses from our panel about where this pandemic goes from here. So, Professor Eisenberg, I'd like to start with you. Could you tell us a little bit about what we know today in terms of how the coronavirus is spread?
Yeah, coronavirus is a respiratory pathogen, and like other respiratory pathogens, such as influenza, it's primarily spread through what we call droplet spread. That is, particles that you emit when you talk, sneeze, or cough are then emitted into the air, and then directly anybody who is in close proximity to that person can become infected through that droplet, either through their eyes, nose, mouth, touching, and through membranes, or through inhaling that virus. And in addition to that, what we think of as that dominant mode of droplet spread, that is big close contact and the movement of particles from the infected person to the susceptible person that's being exposed, there's also what we call fomite spread. That is, the virus can move in and drop onto tabletops, any kind of inanimate object, even onto your hands, and then you can contaminate doorknobs or any other object, and then somebody can then touch that object and again touch their eyes, nose, or mouth and become infected. So those are the principal modes of transmission. We also think that it's possible, just like with influenza, that it can actually aerosolize and stay in the air for a while. That's when the virus is adhered to small particles that just don't drop down for quite a long period of time. And then somebody could inhale that aerosolized virus and also become infected.
So you hear a lot about this 6-foot distance. We all should maintain a 6-foot distance among other recommendations. What's the magic about the 6 feet?
nothing magical about the 6 feet, but it is about how far those particles that you're emitting from your mouth can travel. And viruses tend not to move on their own. They tend to adhere themselves to particles, and the larger particles will drop more quickly. The lighter particles will go a little further, depending on if you're sneezing, coughing, or talking. The particles will go potentially further. 6 feet seems to be the distance where most of the particles seems to drop off and fall out, and therefore, if you're beyond the 6 feet in general, your exposure is going to be much less. There are particles if you have an intense cough or you're singing, that there is chances that some of those particles go further than 6 feet. Also, again, the smaller particles will go farther, but the experts tend to agree that 6 feet is a good way to minimize risk.
Dr. Netzer, we're talking about minimizing risk, which is really one of your areas of expertise. Could you talk a little bit about the hierarchy of controls, what that is, and why that's relevant for this?
Yeah, absolutely, Jonathan. So again, just to reiterate, I am an industrial hygienist. For those of you who may not have even heard that occupational title before, we focus on occupational health, so keeping workers safe from hazards in the work environment. And the hierarchy of controls is a framework or a paradigm that we've used for many decades now to effectively reduce risks in the workplace. It's called a hierarchy because it actually specifies different rankings of the types of approaches we can take to make workplaces safer. So regardless of the risk, if we're talking about radiation or a chemical you might breathe or potential exposure to coronavirus, the hierarchy remains the same. So if we start at the very top, the most preferred level of the hierarchy is something we refer to as elimination. Now, in the case of COVID-19, really the only way to get us there is to develop an effective vaccine. As we know, there are many groups working on this. Hopefully that will happen. But with that sort of out of the picture, at least in the short term, we move down to the second level of the hierarchy of controls, which is something called engineering controls. And this means basically we're re-engineering the workplace, physically changing the workplace's characteristics and the processes within to reduce the risk of contact between a worker and the hazard, in this case, coronavirus. So this could include, for example, moving workstations physically apart, increasing ventilation, other types of approaches that, again, are going to reduce the time and dose that someone might be exposed to in terms of the coronavirus. After that, we look at administrative controls. So these are a little more complicated. These would be changes in the work process and work behaviors in the workplace. So this would be, for example, recommendations or requirements that workers wash their hands regularly, or that they maintain social distance even when there's a possibility for them to be within 6 feet of each other. This is less preferred because we're asking people to change behaviors, and I don't know about you, but my take on humanity is behavior change is very challenging for lots of us. And then the lowest level on the hierarchy of controls is personal protective equipment, PPE. We put this last, not because it's ineffective. PPE can be quite effective, but in relying on PPE, we're asking people and expecting them to understand how, when, and where to use their PPE and how to use that PPE properly. That's a lot of demands on the end user. And PPE in this case would be, for example, a respirator, for example, an N95 respirator, or a surgical mask, a 3-ply mask, or facial coverings like many states have recommended people use. And I'll wrap up just by saying the hierarchy of controls, again, gives us a rank order that we approach these problems with, but it's almost always best to adopt multiple layers of the hierarchy of controls. So we try to get sort of defense in depth, where we might try engineering controls and administrative controls and still require some PPE.
I'm going to aim this towards Professor Eisenberg, but if somebody else wants to grab it, you're welcome to. You've mentioned in the past that this is not a very hardy virus, not very strong outside the body. Could you talk a little bit about that, and maybe compare that to some other viruses, maybe the norovirus, in terms of its hardiness?
Right. I think there's a lot of pathogens which we classify as waterborne, foodborne pathogens. They tend to cause diarrheal disease. They're in the class of enteric pathogens. And those tend to be the pathogens that are much hardier and persist much longer. Norovirus is a good example of that, and probably one of the hardiest of those enteric pathogens that we have to deal with. And intensive cleaning and bleach is really needed to inactivate and kill that the virus. And if it's allowed to persist without cleaning, it could last for weeks or months on a surface and still be viable and still infect somebody. Respiratory viruses are much less hardy and don't survive in the environment as long, but they do survive. But we're talking about hours and maybe a day, depending on the surface type, depending on a lot of factors like temperature and humidity. But they are much more on the extreme other end of their ability to survive is quite limited. So we think that contamination and is a potential spread through what we call fomite or contact, but not nearly the same level as many other pathogens.
So how well does soap take care of this? And Nancy, Dr. Love, if you want to grab this as a microbiologist, you're nodding and smiling. How well does soap manage this?
Yeah,
soap and water.
So I would put soap and water at the top of the list of self decontamination methods. Everybody is familiar with hand sanitizer as well. I would put that second on the list. Any chance you have to use soap and water to wash hands, and then, you know, I think some of the common questions are when I receive a package or if I'm in the store, you know, my practices are I wash my hands with soap and water before I go to the store. I have sanitizer when I'm, you know, coming out of the store, but I use soap and water when I'm back home. And those practices, I think, are very effective as, you know, self-protection from the standpoint of contact. Then I also, of course, use a mask when I'm in those public spaces. One of the things that is easy and helps make it easy, and I think both Joe and Rick will speak to this, is the 3 C's. Places that perhaps where you have your higher risk are closed spaces, crowds, and contact surfaces, as Joe's already spoken to. So if you think about those 3 C's, having the mask to protect you from exposure in the places where you're vulnerable, and using soap and water, primarily sanitizer if you don't have the soap and water, to wash your hands for contact, and you're doing a tremendous amount of work to protect yourself and reduce your risk.
So you're saying that alcohol-based sanitizers are effective at deactivating or killing the virus. I don't know if it's a deactivation or a killing. I'm not sure that it's not alive, but that they are effective.
It'll destroy the virus. This is an envelope virus, and you'll destroy its ability to kind of reproduce itself. So the sanitizer is very effective with this virus. As Joe mentioned, there are other pathogens where it's not, such as the norovirus. So soap and water is always best because of it'll address a multitude of different types of pathogens, and it's you know, usually very accessible. But if it's not, then the hand sanitizer with 60% or greater ethanol is your best choice.
So, Dr. Love, one of the areas that you've been working on is N95 masks and the ability to recycle N95 masks. So you've learned a lot about them. Can we talk a little bit, pivoting into masks that you raised, another form of PPE, what makes a mask effective? And you talked a little bit about the story of the candle, or one of you did in a prior session. So maybe we'd want to talk about that a little bit more.
Sure,
also.
yeah. I'll just, and Rick made this, I think, mentioned this, the 3 different kinds of masks. You have your N95. This is a respirator. When you put this on, you're actually sealing it around your face, and all breathing goes through the respirator. This is not commonly needed for public purposes. You know, if that's what you have, that's what you have. But I've worked with mostly in the hospital and surgical settings. You have your surgical kind of mask. Normally you wouldn't touch it the way I just did there. You only touch it here. That has a bridge over the top to seal around your nose, and you can seal it. If you have glasses, You can soap and water clean them so that you don't get the foggy buildup. But if you've got it sealed well and then you put your glasses on, you will be able to prevent that foggy buildup. And you touch it, you put it on this way and you take it off this way. This has 3 layers. The inner layer is typically this polypropylene layer. If I were to take water and spritz it on it, it would bubble up, meaning it prevents that moisture from going through, and that's that middle layer that largely prevents particle movement through and much of the moisture. And then you have your face covering. I have a fancy one here that's really pretty. And it's a 2-ply. I actually have an opening here. I can put my 3rd layer inside if I choose to. And this is washable. So the point is all of these are what Joe calls risk avoidance. So now you're really reducing the potential for either the virus to leave you if you are symptomatic or asymptomatic, if you're spreading it in some way, but it also protects you from exposure from others. And one of the real visuals that has been effective for me is when you put on like a surgical mask, which is less effective than an N95, and you sigh and you have a candle sitting out about that 4 to 6 feet. If you didn't have the mask on and you sighed heavily, that the candle would flicker and possibly go out. If you put the mask on and you do that same sigh, you won't even see the candle flicker. That's an effective mask that you could wear, and you'll see that impact then of how it reduces that risk of movement of your your air passage out, and therefore any droplets that might have made their way out into the open.
So as you talk about this is about somebody restricting the droplets that are going out, not the virus coming in. Perhaps Professor Eisenberg, actually any one of you, could you talk about what the role is of a mask? Is it for protecting me, or is it for me protecting everybody else from me?
I can.
Professor Eisenberg.
Say a little bit. I think it's traditionally masks have been used. I would say, except for very high risk situations, but it's meant to prevent somebody that's infectious from spreading the virus to other people. And the reason why we've moved from it being optional to mandatory in indoor settings right now is because of the potential for asymptomatic people who don't have symptoms but are actually infectious, to be able to spread. So none of us know if we're contagious because of that, and therefore the move was to say that everybody should be wearing masks. And so it's important to realize that that's kind of the motivating reason. That being said, there is going to be it is going to protect you also to some degree, because it is a barrier to at least for the inhalation. Now, clearly, there's a lot of different transmission, where membrane transmission, where if you touch something that's contaminated and you touch your eyes or nose, that's obviously not going to work unless the mask itself prevents you from actually doing that. There's not a lot of strong, I would say, what I call epidemiologic evidence, that is evidence that it will protect, but you as an individual. But there is a fair amount of evidence about the physical properties of the mask that would suggest that it is decreasing, the kinds of doses that you would get if you didn't wear that mask.
So you talked about the N95, and in this industry, we're familiar with the KN95, which is the Chinese standard. And I'm not going to go into the various types of N95s. You can get into a deep level of detail about all of these masks. And then you have the 3-ply surgical type mask, and you have what all of you seem much more comfortable calling face coverings versus masks, which is the last one that Professor Love held up. How do I know that a cloth mask is effective, or what would be a sign of an effective cloth mask?
You know, go ahead, Rick. Yeah, go ahead.
I was just going to say, any face covering you put on, whether it be a cloth face covering or a more formal surgical mask or a respirator, if you start to notice some impediment to your breathing, that means it's actually working. You're breathing through the mask. So if you put a mask on and there's no noticeable change in, difficulty inhaling or exhaling, that mask is not doing, or that face covering is not really doing anything for you. So this is one of the perverse things where the harder it is to breathe with a respirator on, the more effective it is at protecting you against the environment. And Nancy, you were going to add.
Yeah, I was going to say, I know that some people, my husband's an example, who has a hard time with an N95. Some people even have issues with breathing through a mask or a face covering. And I've seen studies that have done work on particle transmission for 3-ply face coverings, like t-shirt type materials, that are about 2/3 as effective as a surgical mask that is ASTM 1, I think the standard is. So that's better than 0. So the order is, N95, surgical mask, and then face covering in terms of effectiveness of particle reduction, typically. But in terms of how do you know, I think what Rick said is right, is how, you should feel some sense that you have that mask on, but acknowledge that some people really struggle with the breathing. And I think that face covering is going to be the easiest for somebody who struggles with an N95, and it's better, again, than nothing.
So in the past, go ahead.
Just to add again to this question, that yes, we think that that there is going to be some advantage with respect to wearing a mask versus not wearing a mask. The concern comes when you think that wearing a mask makes you more invincible, and then therefore you're trading the mask for distance, or distance for the mask. So that is, you're then thinking, oh, now I can be in close contact with people.
Right.
And that's, I think, where the danger is, that and it goes to a little bit to the hierarchy control concept, even maybe for a different reason, that we want to ensure that distance and that physical separation as the primary mode, and the mask is that added protection and not a replacement for other for the distancing.
So if I'm wearing a mask, I still want to try to maintain my distance. Can you talk a little bit about the concept of dosage and why dosage might be important with the coronavirus?
Sure, you want to take that, Rick?
Sure. So this concept of dose incorporates how intense your exposure is. So are you being exposed to a lot of virus or a little virus, but also incorporates the duration of exposure. And so you might imagine some differences in your infection risk between a very short but very high exposure or dose to coronavirus versus sitting in a car with someone for a few hours, where there's maybe a lower concentration than I always flash back to, like my child sneezing in my eyes, which was one of her favorite activities as a child, extreme dose there versus sitting in a closed space with someone for a longer period. So the concept of dose lets us kind of disentangle those things, and we can start to think about, well, how long are you potentially exposed to somebody? Shorter is better. And then again, what is the potential sort of load or concentration of virus in the air? And if you have a mask on, that concentration is going to be lower, and if you don't, it's going to be higher. So we're always factoring in considerations about both time and then again the intensity of the exposure, and also how frequently you're exposed too. So if you're potentially exposed once per day, that's much better than being exposed repeatedly throughout the day. And the dose, again, kind of integrates all of these concepts.
And just to emphasize there, that dose is important because it increases your chance of infection, but we also think that it increases the severity of the outcome when you do get infected. So dose is a very important concept for both those reasons.
So if I pass somebody in the supermarket, or I pass somebody in the hallway of an office, and I'm clearly in our office today, you see people shrink against the wall. If I'm just walking by with a mask on, I don't really have it sounds like I don't have a reason to be concerned because the dose is going to be small if I'm in that kind of space. Is that accurate?
Yeah.
I've asked you in the past about gaiters, those neck coverings that people sometimes use, and your eyes sort of got heavy and your body sagged. So as a face covering, you don't always recommend those, I believe, and I'd just like you to talk a little bit about why.
Well, let me just throw out one comment here, which is anything that's covering your nose and mouth is better than nothing. So, if I have a single piece of dental floss tied around my face, covering part of my mouth, is that going to reduce virus? Maybe. A few viruses might actually impact on that dental floss. If I have multiple strands of dental floss, that's going to be better, and that might be more like the gaiter you're talking about. But clearly, several orders of, or an order of magnitude less effective, for example, than the N95 that Nancy was talking about.
Mm-hmm. And
So
I think some people are using those. One of the issues is indoors versus outdoors. And so oftentimes you might see the gaiter as something that one might pull up if they're outdoor. But I was out this morning out for a long walk, and about half, I maybe encountered 10 people, about half of them had masks on, some had a gaiter, but they're outside. And I think Joe can get to this whole dose issue. It's a little, probably something I wouldn't feel I needed to do as long as I'm by myself and I'm away from others. Outside, the dilution effect is huge, so I don't need that. But if you're going to be out running and then you got to go inside and you need something to pull up, it could be very convenient for that. And again, it gives you some level of protection.
Professor Eisenberg, do you want to talk about this? Do you wear a mask when you're running? And if not, why not?
I don't, and much for the reasons that Nancy mentioned, that when you're outside and you are pretty much alone, or maybe you're running with somebody next to you, but you're not really looking at each other, you're facing forward, that any kind of exposure is pretty minimal. That there's, because of the ventilation, the movement of air outside, that it just dilutes any potential pathogen dramatically. Now, obviously, if you were, and I think there's published studies from the New York Times saying, well, if you're running right behind somebody, you got to be more than 6 feet distance because you're right behind them. So yeah, I would not recommend running right behind somebody. I would recommend running side by side, and therefore, the need for a mask outside is pretty minimal.
So realistically, masks are pretty inconvenient for most people. Nobody really loves wearing them. For a lot of people, they talk, the mask starts to slip down, and you see some people who have it below their nose. So the question then becomes, can one spread COVID through their nose, or is it necessary in one of these don't try this at home questions to have your nose covered for the mask to be effective, if it's all about controlling the droplet spray?
So I'll dive in, Jonathan, and say what you're describing, basically the situation where someone is partially protecting themselves and others, is exactly why we put PPE down lowest. I mean, sort of the worst case scenario is someone who thinks they're protected, thinks they're behaving properly, and that they have their mouth covered, but they're not, because their nose absolutely represents an entry pathway for them to be infected, but also potentially a route of transmission if they sneeze on somebody again and have exhalation through their nose. So again, a little bit of protection, probably better than none in terms of a gaiter versus a mask, but having half of your breathing system open to the air, not a good approach.
Yeah, and can I just add something? I mean, the masks are designed to cover both, and there's a reason for that. I also want to go back to, just briefly, we were talking about outdoors. I want to be really clear to distinguish outdoors running in a park from being in a public event outdoor. A public event outdoor where people are close is like a closed space. I would wear a mask in a public event where people are close to each other. That would be my advice. I want to be distinguish those, because that just being outdoors in and of itself means outdoors and spread out versus outdoors and close. You should have a mask. Close.
Move on to the mask itself. How many times can I wear a mask, cloth face covering, before I have to wash it?
So I think the notion there is that you're looking at how soiled or dirty it is. What I'm doing, I'll just share what I'm doing is I have, you know, my child's sized mask here. I have 6 of them so that we can do daily cycles. You know, if he's going out a lot right now, he's around the house, he's not wearing a mask, but we drag him out to go get crickets for his lizard, for instance, or whatever. And we are using kind of a daily process. You have your Monday mask, your Tuesday mask, and you can wash that and then put it in a bag and use it the next Monday or the next Tuesday. So you have this cycle until as long as the mask is in one piece and looks fine and clean, you're good. If you're going out for 10 minutes, that's not a lot of time, and you can probably use that mask again the next day. But if you're going to be doing a full day of running around and going out and doing a number of things, I would clean that mask. On these types of masks, we've been using dots. So I've got 4 people in my family, and dot 1 Monday is me, and dot 2 Monday is one of my sons. And we can, again, keep track of whose mask is whose and keep them separated, and then reuse them until they look soiled. And then these you dispose of course, once you've done that. And I know people who've done that up to 4 weeks, and yeah.
So you're going to use the 3-ply mask, the disposable mask, until it looks soiled. There's not is there some sort of science about how long you can wear it or how many shifts you can wear it?
I'm in terms of this one,
Yes.
I'm not familiar with that other than fraying. The polypropylene does fray, but it's inside. So usually it's fine. It's really a soiling visual that or you lose your elasticity and you can't hold it on your face.
So if somebody asks one of our people, can I wear this for a full shift during the day at work? Are there any factors that they need to think about? We're assuming that they're not working in a COVID ward, but I'm in an office or I'm in a factory. Is there anything else that we need to worry about in terms of giving them advice on how long they can wear a mask?
I think that what Nancy had said, I think there's 2 pieces. One is the fit, like, you know, as long, does it still fit, or is it sort of the elastic so worn out that it doesn't really have a good fit? So the fit is an important thing, and then it being soiled or potentially contaminated is the other piece. The contamination piece, again, I think the longer you wear it and the more moisture that gets developed, that could be a good indicator to say, okay, maybe I should be setting this one aside and let it dry out and let it give it a couple days, or even if you have this cycle, as Nancy mentioned, a week, and then use something else or replace it with something that hasn't been used. It does go to also the fact that you really want to use it when you need to use it and not when you don't need to use it, because it will last longer. So again, if you're outside or in a car and you're alone, maybe it's time to take it off, and so you're not, you know, continually using it, only using it when you need it.
Yeah, and the week versus a day. So we've been doing research with coronaviruses on mask surfaces, and we have done human sputum on a mask surface over a day, and we do see loss, but it's not all gone. By 7 days, it's going to be gone. So this notion of making it easy to have a weekly cycle is really, I think, part of that process of reuse. Makes it easy for individuals to not get confused on which mask. And if you're going to wear it all day, you know, that is getting access to these is a little tricky, but that's a judgment call, I suppose, in terms of whether you reuse that one a week later. But if it's sat for a week and it's in fine shape, you should not have any residual virus at enough of a level that's going to be a concern. Just don't touch it. Just touch these things. Don't stick your hand all over as you're putting it on. It should help reduce that opportunity for contamination from other things you might have touched.
Do you recommend people wear a face mask in a cubicle?
I mean, I'll chime in and say it depends on the cubicle. So if you have a cubicle that has walls that go virtually up to the ceiling, as some cubicles do, or at least 6 feet high, I would consider that basically to be your own isolated space. You're not really in the same airspace as someone on the opposite side of the wall. In that case, I would say no, you're effectively working alone. If you're in a cubicle farm with 3-foot walls and you can see as far as the eye can see, innumerable cubicles, you are very much sharing the same airspace. And in that case, I would definitely encourage people to preferably distance themselves at least 6 feet within that space, but also wear a mask.
If I'm distanced, do I need to also wear a mask? Or if we spread the cubicles, is it okay just to spread the cubicles and not to wear a mask?
And again, distance, as Joe mentioned earlier, there's nothing truly magical about 6 feet. So my inclination is always more distance is better. So if you imagine a quite large room with only 2 workers in it at the opposite ends of the room, they're not really, again, exchanging air. They're not exchanging virus. Those same 2 workers working exactly 6 feet apart in that same room, I would be much more concerned about. That doesn't exactly answer your question, but just to give you a sense of my thought process.
Yeah, we're right
there's
now
also
at 144 square feet per person with masks. And then if you have 2 people, it's 288 square feet with masks and multiples of 144 for indoor work at the university, which may be, Joe, you may speak to that. That's maybe the most conservative kind of estimate.
I was just going to add in the mobility piece, because it's if people are sitting even 6 feet or more apart, if they're getting up all the time and they're chatting with each other, that isn't always maintained. So that would be the other reason why you may not. You may want to have that mask in addition.
And the other thing is orientation. So if you've got 2 people sitting face to face 6 feet apart, that's a much different circumstance than 2 people facing away from each other at that same distance. So in the first example, I think a mask would be absolutely recommended. In the second, it might not be as important.
How effective are face shields versus masks? Because there has been some writing about the fact that I have seen people moving to face shields and eliminating masks. Is that effective? Is that something you would recommend? And does that change if you're in a cubicle? So 3 questions there.
I think Rick's going to have some comments to that. I'll tell you that I know of the face shields being used certainly in medical applications, really to protect the mask, so the mask doesn't get soiled and can be reused quite a bit. It's got a lot of, it's open on the sides, but Rick, maybe you have some comments on that.
Yeah, so what the face shield gives you effectively is this physical barrier. And so if you're going to have intimate contact with somebody, now we're not just worried about inspiring or inhaling the virus, but also potentially getting it on your mucous membrane. So if that person coughs or speaks or sneezes, now we have this eye route of transmission. The face shield is going to effectively block that. So it's going to keep the mask clean. It's going to protect your eyes. And I would say, for contact that's going to be fairly intimate, imagine going to the dentist where, you're 1.5 foot away from someone's gaping mouth and potentially their asymptomatic conditions. In that case, a face shield is going to protect you from the physical transmission, but you're still going to want a mask because you're in that person's breathing zone as well. So again, we think about things as layers. I would not recommend a face shield for someone sitting in a cubicle unless they're doing dental work in the cubicle, as I said. So we would really need that close, intimate contact before the face shield would become a requirement in my mind.
But is it a substitution for a mask? If I don't like wearing a mask in a cubicle, Professor Eisenberg, you're shaking your head no.
Yeah, I think we'll all shake our heads no on that.
Yeah,
so
it's again, the mask. The shield. It's for that high risk exposure situation where you are expecting to get direct projectiles of particles from somebody's mouth towards you. The shield is going to, prevent any membrane contact, including eyes and nose. And it shouldn't be considered a replacement for mask, and is not really necessary in lower exposure situations. And the more you're not exposed to that direct projectile, the more that actually these particles are moving in all directions. And so the face shield is not for particles that are coming from the side, the face shield is not actually obviously protecting from them from that. So it is an effective barrier for a specific situation, but shouldn't be replaced by the mask, or it shouldn't be replaced.
I'd like to move on to this whole idea of fomite transmission, which is the transmission that you're getting from surfaces. And one of the things that we've seen, at least in our industry, is people using UV lights to try to sanitize objects. And I know, Professor Love, you've done some work on this, or I believe you have, with UV lights. Is UV, and let's not talk about a room UV light, but small portable UV lights, are they effective at killing the virus, and what would be the potential upside and downside of a UV light?
Yeah, so the UV definitely, so again, UV, it's a dosage kind of situation where it's how long, how strong your lamp is and how long you expose for, and those together create what's called the fluence that would, the higher the fluence, the greater the kill of the coronavirus. And yes, it's quite effective if used correctly. If it's a hard surface, it's going to be much easier. There have been challenges with penetrable surfaces like masks because it can get on the inside, and then the UV lamp, if there's any shadowing, will not necessarily help you there unless it's a really high dosed lamp. So from a surface standpoint and using a lamp, it's the time. So it's time times the intensity of the light. And so you can't just scan it across and be done. You have to know what those, you have to calculate those numbers and figure out what that fluence is. Right now for masks, they're recommending a very high fluence for decontamination. We've actually looked at this with lower fluence and been able to see, 99% to 99.9% kill of the coronavirus.
So if I'm going to be using a UV light to sanitize, I want to make sure that I'm getting all the surfaces and that there's enough of a dose that it's actually going to be effective.
Yeah.
So I'd like to sort of jump down into some very practical life things in terms of what you do. We've talked about the fact that alcohol-based sanitizers are good for, I don't know if you say killing or deactivating the virus. Can we talk a little bit about these Clorox or Lysol disinfectant wipes? And I don't know if they're ammonia or chlorine based. I understand that they are effective at also killing the virus. Are they more effective than alcohol?
For coronavirus, I'm not sure that I know that they're going to be different. They're different for other pathogens. As Joe said, the coronavirus is different from norovirus in terms of its structure. And that structure difference makes the coronavirus very vulnerable versus a norovirus, which is going to be less vulnerable to alcohol and much more vulnerable to bleach. But the coronavirus is vulnerable to both. And so I don't know if there's a difference in how vulnerable it is to either. I think it's quite vulnerable to both. I don't know, Joe or Rick, do you have any comments on that? I don't know that anyone's looked at those differences specifically, but it's an envelope virus.
If I was going to translate what you just said, it's that alcohol-based wipes and bleach-based wipes are equally effective in deactivating.
As far as I know, yes.
Professor Eisenberg, is that a yes from you? You're nodding.
Yes, I mean, I agree. Again, there hasn't been the specific studies to actually verify that, but given what we know about coronaviruses and the little that experiments that have been done about it, alcohol wipes will be just as effective as.
I think the thing to think about the wipe is the damage it does to the surface. So I think one thing I want to encourage people, do not use the wipes on your mask because now you're damaging your mask. But if it's a glass surface or a steel surface or maybe even a box or a handle, go for it.
So if I go to the grocery store and bring home a load of groceries, there's been a lot of people in the store clearly breathing. I believe that at least in Massachusetts, almost everybody has a mask on. In other states, it may be different. I suspect it is different. Do you clean your groceries with some sort of sanitizing wipe, or do you leave them aside before you use them, or do you just put them away?
I just put them away. I wouldn't. I mean, the risks in that scenario, to me, are sufficiently low to not be concerned.
And we're going to move aside the issue of fruits and vegetables. Professor Nitzel, you talked about that last time. I'm going to give you the chance to address it before we go beyond that. In the don't try this at home again.
Sure. So I made the comment in our last discussion that we don't wipe down every single one of the groceries, but my wife does a very thorough soak, actually in soap, with our fruits and vegetables, particularly the ones that we're going to be eating the exterior surface on. You know, that has the benefit of killing the coronavirus, but also maybe killing some other foodborne pathogens that we might also be concerned about. So we've opted to be maybe more intensive than some for that particular type of food. But on general grocery, external container surfaces, no cleaning.
Is there a reason to use today? Is it recommended to use soap for fruits and vegetables?
You know, that's a great question. Other than its properties for breaking down the exterior surfaces on a lot of pathogens, perhaps not. I mean, certainly there are specialty washes you can buy. We do not use any of those because that just seems like flushing money down the drain. But yeah, I don't know if Joe or Nancy, you have other comments.
Same as you. Yeah.
Okay.
Yeah.
Do you clean the containers of takeout food when it's delivered? That's a no.
No.
So none of you believe you need a clean
We've been
takeout
going
food?
and picking up and bringing back. Actually, there's one restaurant we go to that has sealed the bag, which is nice, I guess. No.
So let's now get into the home or office in terms of packages. So for a lot of the people, they're receiving Amazon or UPS or FedEx packages at home. And there's a bunch of people, us included, who have receiving docks who are receiving packages. How concerned do I have to be about receiving a package, with the caveat that in the house, I can easily get to a sink, I may be near a sink, but in a receiving dock that may be further away, and that box may be being transferred from here to there. So I'm receiving a box, can I touch that box, and how concerned do I have to be?
Joe, you want to? Yeah.
I mean, I think now we're going into more of a workplace environment, and I think that there's two concerns you might have. One is, again, your personal risk of you becoming infected, and the other is spreading amongst the workers and actually creating a cluster of cases. And that's where maybe the more important thing is that you want, to prevent spread. So you could, making sure that there's lots of different guidance you can give to make sure that it's one person that is connected with this box all the way through the unpackaging, if that's possible, will do a lot to prevent, cross spread, from person to person. I do think that, hand hygiene is going to be important even in the workplace to prevent transmission of this fomite, even though it's lower risk. And so I think that to me would be more important than actually going down and cleaning every single box, which I think could be a lot, more labor intensive and not getting at the actual, transmission piece as much. So
if I leave the box there for some amount of, how long will the virus survive on a box? Can I just leave a box there and go back to it later?
I mean, I think the evidence I've seen would be maybe up to 24 hours on a box. And so one option is to shunt all those boxes aside for 24 hours once received. And then, the risk of anyone further contacting them is dropped substantially, if not to virtually zero.
Right. I would actually want to also mention that when we say 24 hours, that's means that virtually everything has died off. Even if you wait 10 hours, you've probably lost, you've decreased your risk pretty dramatically also. So any amount of just setting it aside is going to decrease risk if there is a risk there.
If you were one of our distributor customers, would you allow salespeople from outside into your office to make presentations today? Let's say in the next 2 weeks. Is that something that you would want people to do? And let's say that the salesperson coming in is wearing a mask.
I mean, I'll give you the party line answer here, which is if they don't have to be there, they shouldn't be there. So that's the only way to truly eliminate or reduce risk as much as possible, is to cut out any of those unnecessary contacts. So if the meeting could be done virtually, then that would be the preferable, but of course there's some circumstances where there may be product to display or things like that where a virtual meeting is less optimal. And so I would say in that circumstance, you know, someone coming in who's screened at the entryway to the facility, and we can talk about screening maybe later, might be appropriate to have a meeting, but my default answer would always be no, unless this person absolutely has to be here, they shouldn't.
I agree. I mean, this is when you're starting to talk about spread, and much the way we talk about the risk of travel and long-term travel. This is short-term and short distance travel, but it is adding this unknown person coming into your office space that your ability to control and mitigate problems are quite good. So again, I wouldn't, just to reiterate, the idea of, and that person wears a mask, takes the mask as the primary intervention. I would say, and that person maintains distance and maybe also wears a mask, but the distance. So if a salesperson comes in and they're like, you're ensuring that they're 6 feet or more apart, that's going to be better, again, than just the mask piece.
It's distance and not in a closed space. So if it's a conference room and it's an extended period of time, right? I mean, I think all these factors of exposure and time have to be considered.
We're going to get short on time. Let me ask you a few sort of quick questions. Would any of you get on a plane today? Dr. Love?
If I don't need to, no. I mean, no, I'm not traveling anywhere. I use a car if I have to go somewhere.
Professor Eisenberg or Professor Nitzel?
Yeah, and I would take Rick's, if you don't need to, don't philosophy in this situation. I think things can change in 3 to 6 months for me, but long-term travel is and is in and of itself the reason why we could get a resurgence. Crowds in the airport and crowds being in this enclosed airplane. All three of those things are make plane travel at this point more suspect. I mean, obviously, if there can be emergency situations. This is not, this can be done at lower risk if you really need to travel for a given situation. But if you can avoid it in any way, avoid it.
Would you eat in a restaurant?
Our restaurants are opening up outside. They're going to have outside tables. We're talking about it as that sounds like a nice thing to do, and with all the protections we've talked about, hand sanitizer or whatever. But I'm not interested in going inside a restaurant right now, even though they're opening up at 50%.
I totally agree with that, with the caveat that, again, there's dose involved here. So eating out once a week at an outside restaurant is much different than eating out every meal at an outside restaurant is different than eating every meal out inside a restaurant. So I think I would order those in sort of progressively higher risk there.
We only have a few more minutes, as I said, so 3 more questions. If I go to a restaurant, I'm using potentially a public restroom. Is there a higher risk in a public restroom? And I know it's higher risk than my own restroom for a whole bunch of things, but let's talk specifically for COVID. Is it a higher risk to use a public restroom, or would you use a public restroom at this point in time? And it can be in a restaurant, it could be in a rest stop on a highway if you're going to take that long drive. Dr. Eisenberg?
Yeah, I mean, I think that if you trust the establishment meeting all the guidelines of what they're supposed to do to clean a bathroom, which is really to get rid of pathogens that are much hardier than this, then, you know, that's really would be my question about the establishment. I mean, so if it's a random rest stop traveling, maybe you don't have that confidence. If it's a restaurant that you know well, maybe you do have that confidence that they're because cleaning public bathrooms, there's already guidelines on what to do, and there has been for a long time, and I think they're good, and a lot of restaurants adhere to those, and then I would have much more confidence. Again, washing your hands right as you leave is like the main thing you want to make sure you do.
And use the towel to open the door handle, things like that. A lot of bathrooms are already set up that way with a garbage can right there. So
which is what you
for a
want
long
to do.
time doing that.
Anyway, right.
For the last question, I want to look forward, and I'll start with you, Professor Eisenberg. We'll let anybody else jump in that wants to. A lot of people are worried about the second wave coming, especially in the fall and winter, and what that is going to look like. We're seeing numbers spiking in a number of states around the country. We see very big spikes around the world in certain countries, but let's put that aside for now. Can you give us a look forward into what you expect in terms of this virus and what's going to happen as we go into the next year, absent of vaccine?
Yeah, I mean, I think that you start out saying that I hate to be doing too much prediction, because the more you predict, the more you're going to be wrong. I do think that if we know what the right things to do are, we know how to, and we're learning more and more about the guidelines that we need to adhere to in restaurant settings, in office settings. We know where the culprit, the areas where we're going to be at high risk of seeing clusters of cases, where we're seeing clusters of cases like nursing homes. If we really focus on these things, we can minimize the chance of having a second wave. When we see clusters of cases and cases increasing right now, a lot of times it's not explainable, but a lot of times it is explainable with respect to certain industries that we're starting to see clusters of cases because social distancing is not happening, or nursing homes, which is maybe one of our most problematic places, are struggling. And what I have to say with that is, what we really want to push more and more is to keep increasing our ability to test. And because if we can test and isolate, it's not so bad to start seeing some cases, as long as you can contain it. In fact, seeing the cases is actually a good thing. So some of the increase that we're seeing is because we're testing more. And if we test more, we'll see more cases. Seeing the cases in and of itself is not a bad thing. It's not actually containing that cluster of cases, which is going to be problematic. And the cluster of the cases is what started everything off in places like the state of Washington. And but all of us were not prepared at that point. The testing capacity wasn't there, contact tracing capacity wasn't there. It's still not where we want it to be, but it's a lot better than it was, and we need to keep moving that up. And
so we are out of time, and that is almost a perfect ending. It's slightly optimistic that we can actually control this thing at some point in time. Professor Netzel, Professor Eisenberg, Professor Love, thank you so much. Very informative as usual. And I'm going to turn this back over to Kelly.
Okay, that concludes the webinar today. I want to thank the panel as well as all of you for joining us. And yeah, enjoy the rest of your day and stay safe, everyone.